60-year-old African American man is at his dermatologist's office for treatment of severely pruritic erythroderma with scaling on his buttock that has been slowly progressing over past 2 months. Patient works as a truck driver and has a history of hypertension treated with enalapril. Patient reports having tried an over-the-counter cream on rash without improvement. Vital signs are normal. On physical examination, he has multiple confluent and well-demarcated pink patches on his buttocks and legs with some scaling and enlarged inguinal lymph nodes. Dermatologist performs a skin biopsy that reveals lymphocytic infiltrate with microabscesses with thickened epidermis. Which of the following is most likely diagnosis? Psoriasis, lichen planus, atopic dermatitis, mycosis fungoides, or Kaposi sarcoma. So in this, the question is, what is the diagnosis? So this patient is having some red patches with scaliness and inguinal lymphadenopathy, and we have to find the diagnosis. So it's mycosis fungoides, which is correct. The other option was psoriasis. So psoriasis is not usually found on buttocks and legs and all that. It is found on knee, extensor surface, knee, elbow, and places like this. So based on location, I will kind of rule out psoriasis. Then lichen planus. Lichen planus is found on on this part of wrist usually, and lichen planus does not have scaling. So this rash has some kind of scaling. Lichen planus does not have scaling. Atopic dermatitis does not present as pink patch with scaling. So my option is mycosis fungoides. And additionally, they have given here that there are microabscesses and lymphocytic infiltrate. So I have actually figured out a few figures for you. Yeah. So this is how mycosis fungoides look like. So there are these confluent patches with this minor scaling, if you can identify. So this is scaling. This is histology of mycosis fungoides. So basically, these are abscesses, microabscesses. But these abscesses contain lymphocytes. So basically, mycosis fungoides is T cell lymphoma of skin. Basically, the lymphoma, the deposition of lymphocyte, CD4 lymphocyte is occurring in skin. So these are all additional lymphocytes, and they form as this small cluster, also known as microabscesses. Okay. Now, if the same disease is present in skin as well as in blood, if these abnormal malignant lymphocyte get proliferate in blood, starts proliferating in blood, then the same condition is known as Sézary disease or Sézary syndrome. So in Sézary syndrome, what you find in blood cells in the peripheral smear are lymphocyte with cerebriform nucleus. So if you can have a look at these nuclei, they are in shape of brain. Okay, so basically Sézary syndrome and mycosis fungoides are essentially same. Only difference is in mycosis fungoides you will only find skin findings. In Sézary syndrome you will find skin as well as the abnormal lymphocyte will start proliferating in blood as well. These abnormal lymphocytes have a very specific nucleus known as cerebriform nucleus, which means that they are shaped like brain. If you can see here, they have brain-like shape.
Thanks for watching. Please give a thumbs up and subscribe for more.